So this is day 5 of the Tiny Feet, Big Steps conference. Me again, Bozu, your host of the Global Neonatal Podcast. I'm with another incredible person, speaker, professor who's here at the conference. And yeah, let's get to know him now. So hello there.
Hello, thank you so much for the invitation to speak for the podcast. My name is Carlos Ramos, and I'm a pediatrician, neonatologist. I'm professor of pediatrics at the University of California, San Diego, where I oversee our global health program for the Department of Pediatrics. Besides the actual program, I also am in charge of some of our initiatives for global health.
Okay, so sounds like you have a global sort of portfolio over neonatal health research and activities. Is that a good way to?
Yes, that's a good way to put it. We have research activities, we have clinical activities, and medical education and nursing education activities.
Amazing. And is it your first time here at the conference?
Yes, it's my first time.
And how did you get to know about the conference?
My mentor when I was in training, Dr. Ramanathan, is the one who actually contacted me about maybe it was 4 or 5 months ago, and told me a little bit about the conference and how important it is, and how he wanted me to participate and help out with the non-invasive ventilation workshop. And that's what I'm here.
Great. Sounds like they've had an impactful person come and put in that knowledge here. What kind of sessions were you running at the conference?
Besides the non-invasive ventilation, I help with the CPAP session. That CPAP is continuous positive airway pressure. But I also have some lectures. I had a lecture on CPAP, again, non-invasive ventilation. Then I had a lecture on quality improvement in neonatology or in pediatrics overall, not just neonatology. That was for the physicians. And I helped also with the point of care ultrasound workshops. That was it's actually a 3-day, like 3 sections, half-day sections. But because I'm here only for 5 days, I won't be able to help with the last session, but it's been really good.
Okay. And what were some of your key points shared from the quality improvement session? What was like the meat of the presentation that you can share?
Yeah. So the meat of the presentation is that quality improvement is simple and is important. I hesitate to say that it's actually mandatory for all of us who work in healthcare to actually have quality improvement initiatives in our facilities.
Mm-hmm.
And it can be from the smallest health post, little clinic, to the largest level 4 hospital with all the equipment, supplies, personnel, etc. We all should engage into activities to improve the care that we give to our patients.
Okay, that is very, very important, more so for the developing context that hasn't got robust infrastructure for research, just to optimize and prioritize QI.
Yeah, absolutely.
And sorry,
no, I was going to say, I mean, QI is also research. And so at the same time that it is research into what we can do to improve outcomes of our patients. People don't think of QI, or QI is not research, but it is. It might not be bench research, as we call it, so it's not in the lab, but it is with patients and improving patient care.
And to explore more on research, are you involved in any research in developing context at the moment?
Yes, I am.
All right. Could you tell us about 1 or 2 of them?
Yeah, so I'm not, besides being a neonatologist, I also have a public health background little by little, that we have been working with many different organizations. And we have worked in Ghana with an organization called Kibeli, which in a project called Making Every Baby Count initiative 2, so 2.0, because they already did the 1.0. And this one is actually clinical research and outcomes. We're looking at how to improve care at the regional and referral center hospitals, because we have seen that we have trained a lot of providers in how to provide resuscitation in the delivery room. But then after the baby resuscitated, then what do we do? the baby gets referred to a larger hospital. And then if they don't have the capacity to take care of babies that need extra support, then the baby's outcomes are not going to be improved. So basically, what we have seen is like the mortality, neonatal mortality, has not improved as much as it should. So this project was to basically a medical education project to train nurses, mid-level providers, sorry, physicians, into how to stabilize the baby, how to provide ventilation, how to prevent infection, how to work with asphyxia, and how to treat a jaundice. Because those were the causes that, at least in Ghana, we were told that the main causes for neonatal mortality were those. So that's one of the projects that I'm involved. And we're in the process of submitting for publication some of the results. So cannot tell you anything yet.
It sounds like it links well with the message of this conference, which is high impact, low tech, save babies' lives. And it's a good thing that you're linked to research projects that basically amplify that message.
No, absolutely. I mean, it really, as you said, it really relates to this conference. I mean, we don't need a $100,000, fancy ventilator to provide, effective, efficient, appropriate care.
Yeah. So where in Ghana is this project being done?
This is done in the southwestern region. So in the capital city of Accra, which is the Greater Accra region, and then Tema region, Eastern Koforidua, and Sunyani.
That's incredible. Incredible to hear of the projects that you're involved in that also link well with what we're doing here at the conference to basically empower the healthcare workers to also feedback in the country setting.
Yeah, absolutely. I have a mentee in Nigeria. She's in Bao University in southwestern Nigeria in Ekiti State. And we are working also more at the community level and with very simple interventions, hand washing, how to provide very simple bubble CPAP. And we have seen an improvement in outcomes. So again, you don't have to be in a tertiary hospital.
Yes.
You don't have to be in Dar es Salaam or in Nairobi to save babies' lives.
I'm hearing a lot of mentee, mentor in your language. Do you supervise PhDs as well?
Yeah, I do. I used to have a basic science lab where I supervise PhDs, but then now it's PhDs that are doing their clinical research experience. Yes.
I also find it very inspiring to hear someone who's so seasoned in neonatology also say my mentor. I think you don't hear that often. And I've caught on to that. I'm just like, okay, learning never ends.
Never. We never stop learning. And I'm being really blessed that having such great mentors in my career, and I continue to learn from them. Sadly, Dr. Ram couldn't make it to the conference this year, but he is an awesome mentor, talking about a Renaissance man, because he really has a great clinical knowledge, great public health knowledge. I mean, invented knowledge even, because the RAM cannula that we are using in many places, not just in Africa, but beyond, including my unit, he's the one who developed it.
Wow. Sounds like, the ideal mentor.
Yes, he was I was his trainee, his fellow when he came up with the idea.
Wow. Okay. So you were there at the inception.
At the inception, at the very beginning.
Great. That's great to hear. And always nice to think of the fact that it takes a village. Be where you are and to be where everyone is. It truly does take a village.
Absolutely.
As we close this chat, just thoughts around the conference. It's coming to an end. What do you think sets this conference apart from other conferences you're involved in?
That's it's a very good question, because I noticed many things that really set this conference apart. The fact that it's Pan-African and it's not just a physician conference or a nursing conference. So this is really a multidisciplinary meeting. And not even that, we actually work together during most of the sessions, which is different than many other conferences that seems to be like two completely separate tracks. In this one, no, we have our main sessions together. Some of our workshops are done together, social activities, which is really good that at least for most of the attendees from the continent, they get either a low cost or no cost way of attending the conference, which is great because you know how difficult it is for some of our colleagues here they had to leave their place of work, so they're not gonna be paid for the time that they're here to be here and pay for such a it's an amazing conference. There's a lot of knowledge to be imparted, but it's also something that we need to consider when we organize something like this. So I think that really sets the meeting apart. Also, the fact that it's really a lot of hands-on, workshops, the non-invasive ventilation for ones, the point of care ultrasound also, and many others that I didn't have time to get involved because there's only, it's one person and there is so many, many, many great activities going on at the same time.
Yeah. Thank you so much for sharing insights and just feeding your knowledge to me and everyone who's listening. So this is day 5 of the conference. What beautiful Arusha with the beautiful Mount Mary in the background. And yeah, thank you so much.
You're welcome. It's an honor being here.